Just 1 cup of coffee. Skipping a single dose of medication or losing one night of sleep can turn your blood test results into something dangerously misleading. Have you ever stopped to imagine the consequences? My name is Ethan Marshall. I'm 60 years old, an endocrinologist in the United States, and I've spent my entire career caring for patients' health. Let me start with something that may surprise you sometimes. Just drinking a small cup of coffee before your blood test can completely change the results, and that can lead to the wrong diagnosis, even the wrong treatment. Hard to believe, it's true. If you've always thought blood work was just a simple process, show up at the clinic, give a sample, and leave, then I want to invite you to stay with me for the next few minutes. What you're about to learn could save you from a lot of unnecessary trouble. And before we dive in, I'd like to ask for your support. Please subscribe, hit like, and share this video so more people can get the right information and so I can keep producing quality content to help the community. Now let's take a step back and look at the bigger picture. Blood tests are one of the most important tools in modern medicine. They're like a mirror reflecting the inner state of your health. From blood sugar and cholesterol to liver and kidney function, even your immune system. With just one small vial of blood, a doctor can spot signs of diabetes, hidden cardiovascular risks, or even the early stages of kidney disease. But here's the catch. This mirror only tells the truth if it isn't clouded by mistakes in preparation. Even a tiny slip, like eating a bite of food, forgetting to mention your medications, or fasting too long, can throw your results off. And you know what happens then. Your doctor may think you have a condition you don't actually have, order additional expensive tests, or even prescribe medication you never needed. The consequences don't stop at inconvenience. Some patients have to make repeat visits, wasting time, energy, and money. A 2023 study from U.S. endocrinology labs found that 20–30% of tests had to be repeated simply because patients didn't follow the prep instructions correctly. That slows down diagnosis and adds pressure on the healthcare system. I've personally seen patients shaken and anxious when they received bad results, only to find out later that it was all because they drank a sugary soda that morning. I want you to remember, this blood work isn't just a routine step. It's a conversation between your body and your doctor. But if you enter that conversation with the wrong information, your health story will be told in the wrong way. Proper preparation before your blood test is the key to unlocking the truest picture of your health. So now let me leave you with a question to think about. Which do you believe is more dangerous before a blood test? A. Eating or drinking something that skews your results. B. Skipping important medications like blood pressure or seizure drugs. Share your answer in the comments and tell me why. Common mistakes often happen around fasting, taking medications, and personal habits right before blood work. One of the biggest errors is misunderstanding what fasting actually means. Many people assume it simply requires avoiding solid food, while in medical terms, fasting means you should only drink plain water. Having coffee, tea, juice, or even a piece of candy in the morning can alter blood sugar, insulin, and triglyceride levels. These changes distort results, preventing them from accurately reflecting your body's metabolism, and may lead to misdiagnoses such as diabetes or lipid disorders. Alongside improper fasting, another widespread mistake is fasting for too long or skipping prescribed medications. Some patients worried their medications might interfere with the test deliberately fast for 16 hours or more, and even skip their daily doses, especially blood pressure medication, diabetes medication, or seizure medication. This behavior can be dangerous. A person with diabetes risks hypoglycemia, dizziness, or even fainting during the blood draw. A patient with hypertension may experience a sudden spike in blood pressure if they skip their pills, increasing the chance of cardiovascular complications or stroke. For individuals with epilepsy, missing just one dose can trigger a seizure. This shows that overfasting or skipping medications not only distorts test results, but directly endangers patient safety. Another seemingly harmless habit that significantly affects results is exercising intensely right before the test. Heavy physical activity can temporarily elevate creatine kinase CK and creatinine, and also shift liver enzymes and glucose levels. Such changes may lead a physician to suspect muscle damage, impaired kidney function, or liver disease incorrectly. These abnormal readings caused by exercise often force the patient to return for repeat tests, resulting in added expense and unnecessary anxiety. Finally, dehydration is another overlooked factor that directly impacts blood test quality. When the body lacks water, drawing blood becomes more difficult, and test results for kidney function and electrolytes are more prone to error. A patient could be mistakenly diagnosed with kidney disease or electrolyte imbalance, when the true cause is simply insufficient hydration. From this analysis, it's clear that following proper fasting instructions, continuing prescribed medications, avoiding strenuous exercise before the test, and maintaining good hydration are not just recommendations, they are essential principles. These basic yet vital steps ensure more accurate blood test results and protect patient safety, forming the foundation for effective diagnosis and treatment. Several external factors can distort blood test results, including alcohol consumption, temporary illnesses, and dietary supplements. Alcohol is one of the most common yet overlooked contributors. When someone has been drinking heavily, for example, after a vacation or a series of parties, lab values, such as liver enzymes, triglycerides, and blood sugar often rise above normal. This means the test results no longer reflect the person's true health status. In many cases, doctors must reschedule the patient for a follow-up test after a period of abstinence from alcohol, which delays health assessments, wastes time and money, and causes unnecessary worry. Another issue is the effect of temporary illness or short-term medications. For instance, a patient on antibiotics for bronchitis or another infection may show elevated liver enzymes. This does not necessarily indicate serious liver disease, but rather a temporary side effect of the medication. If the treating physician is unaware of this context, they might suspect underlying liver problems and order additional tests. However, there are situations where testing liver enzymes during treatment is essential, such as when patients are taking statins for cholesterol control or antifungal medications over an extended period. In those cases, the purpose of testing is to monitor for potential drug-induced liver toxicity. This highlights how timing and the purpose of testing must be carefully considered to avoid misinterpretation. Beyond alcohol and medications, dietary supplements are another significant source of error. Biotin, a B vitamin, often found in hair, skin, and nail products, is a prime example. Biotin does not harm the thyroid itself, but it interferes with laboratory methods used to measure thyroid hormone levels, producing falsely low TSH results. The consequence is that a patient may be wrongly labeled as hyperthyroid, or assumed to be on excessive thyroid medication, leading to unnecessary dose changes and potentially worsening their health. For this reason, stopping biotin for at least 2 to 3 days before blood work is strongly recommended to ensure accuracy. Taken together, alcohol intake, acute illnesses, and supplements share a common thread. They create temporary biochemical changes that can easily mislead physicians interpreting test results. If unrecognized, these changes may produce abnormal findings, result in incorrect diagnoses, trigger inappropriate treatments, and require repeat testing. Careful preparation and honest disclosure about alcohol, use medications, and supplements are therefore essential to maintain the reliability of blood test results. 3 critical factors can determine the accuracy of blood test results: the timing of hormone tests, sleep patterns, and full disclosure of medications. Hormone testing is strongly influenced by the body's natural circadian rhythm. For example, testosterone levels in men peak early in the morning and gradually decline throughout the day. If blood is drawn in the afternoon, the results may appear falsely low, leading to an incorrect conclusion of hypogonadism. Similarly, cortisol, the hormone that regulates stress responses, reaches its highest point around 8 a.m. and its lowest around midnight. When adrenal insufficiency is suspected, doctors typically order morning tests to confirm whether cortisol reaches the expected physiological level. Conversely, when investigating Cushing's syndrome caused by excess cortisol, testing is performed late at night or through midnight saliva samples to see if cortisol drops according to the normal daily cycle. Taking blood at the wrong time can therefore produce misleading results, resulting in misdiagnosis or missed conditions. The second factor is sleep. Adequate rest that aligns with normal circadian rhythms plays a vital role in hormonal fluctuations. A person who has stayed up all night or worked a night shift may show abnormal testosterone or cortisol levels even if they are otherwise healthy. In such cases, the results reflect a temporary disruption from lack of sleep rather than true disease. That is why patients should be advised to maintain sufficient regular sleep before undergoing hormone-related tests, avoiding factors that disturb biological rhythms to ensure more accurate outcomes. The third factor is honest and complete disclosure of medications. Many patients forget to mention treatments from outside clinic, supplements obtained from aesthetic centers, or testosterone therapy, which can cause doctors to misinterpret the data. For instance, testosterone therapy can elevate red blood cell counts, potentially leading a physician to suspect bone marrow disorders or hematological diseases if they are unaware of the treatment. In clinical practice, incomplete reporting of medications often results in unnecessary, complex, and costly diagnostic investigations, while also increasing patient anxiety. Finally, attention must be paid to the timing of tests after medication adjustments. Each drug requires a specific period to reach a stable therapeutic effect. Testing too soon after changing a dose may not reflect the true impact of treatment. For example, thyroid hormone therapy typically takes 6 to 8 weeks to stabilize, so testing after only 1 or 2 weeks can lead to inappropriate dose changes. Thus, the accuracy of blood tests depends not only on laboratory techniques, but also on the precise timing of sample collection, adherence to proper sleep, and thorough disclosure of medications. These may seem like basic principles, but they are decisive in ensuring reliable diagnoses and effective treatment. One of the most overlooked yet critical factors in blood testing is timing, when the sample is taken and when the results are ready for review. A common mistake is waiting until the very last minute before a scheduled appointment to get blood drawn. The problem is that the lab may not process the results in time, leaving the physician without the full picture needed to provide accurate guidance. In many cases, patients are forced to reschedule or wait longer, delaying early detection and timely intervention for health issues that could be serious. On the other hand, some people delay their blood work far too long after being instructed to test. This can be equally risky, as essential markers like kidney function, liver enzymes, blood sugar, infection indicators can shift quickly. Prolonged waiting means abnormalities may progress unnoticed, and complications such as acute kidney failure or bloodstream infections could advance before being detected. Clinical practice has shown many cases where delayed testing led to late diagnoses of severe conditions that might have been prevented with timely follow-up. This demonstrates that arranging blood work at the right time is just as important as following technical preparation steps. The key takeaway is clear, proper preparation ensures accurate results, prevents unnecessary repeat tests, saves time and money, and reduces anxiety for the patient. But beyond medical practice, preparation carries a deeper meaning. In his work, Rational Fasting, published in English, often referenced from Mucusless Diet Healing System, Professor Arnold Ehret emphasized that the body can only achieve true health when the digestive tract is cleansed, the blood remains pure, and waste no longer accumulates. This cleansing, he argued, provides the foundation for the body to restore itself and maintain balance. Applied to blood testing, the principle is strikingly similar. Just as the body requires cleansing and discipline to heal, test results only reflect truth when preparation is thorough and correct. Skipping preparation is like looking into a foggy mirror. The reflection is distorted, and decisions based on it can be dangerously wrong. Patients must therefore take preparation seriously, respecting timelines, following fasting instructions, keeping honest records of medications and supplements, and living with discipline. Only then can blood tests truly serve as reliable tools for diagnosis and treatment. This is where modern medical science meets the timeless philosophy of body purity. If you want lasting health and the right care, you must begin with responsible, careful preparation in even the simplest steps. The deeper lesson here is that preparation, no matter how small, is always the key to meaningful outcomes in medicine and in life. Practically, this lesson can be applied by building disciplined daily habits, eating a clean diet, getting sufficient sleep, being honest when sharing health information, and following medical guidance carefully. With this kind of preparation, we can reduce worry, avoid errors, and move closer to a life of resilient health. Now, I'd like to ask you, which do you think is harder when preparing for a blood test, fasting completely with only water, or being fully honest about every medication and supplement you're taking? Share your answer in the comments. Finally, I invite you to fill out the form linked in the description to receive a free ebook on healing health practices. And don't forget to subscribe to the channel, hit like, and share this video so we can continue bringing you valuable, practical, and trustworthy content.